No wicked weather in the upcoming forecast, so this might be the perfect time to make sure you're emergency prepared. Joining us now, the Onondaga County Health Commissioner, Dr. Katie Anderson. Always good to see you. Thanks so much.
Thanks for having me.
So when we mention emergencies, like what are we talking? I think most people would think like, you know, some calamity, a tornado that goes through or something like that. Emergency can be much more than that. And I don't mean in scope and size necessarily, but many things fall under that umbrella,
That's right. So when we're thinking about household emergency preparedness, we're thinking about any number of things that could be natural disasters. So your ice storms, your wind storms, your summer thunderstorms, your snowstorms. But beyond that, it could be things that are less predictable, like power or water outages. Or we go back a couple of years to the complex and extended experience that was the COVID pandemic. So really any experience that might disrupt your family's ability to access the supplies or help you need. So the goal is to make sure you have everything on hand for your family for at least a couple days to get you through whatever may come your way. And to put it in practical terms, imagine how you would feel if the next time a big storm is coming through, you can heave a sigh of relief knowing that you don't need to get in your car on uncertain roads, go to the store and fight through a crowd of people to get the toilet paper and water you need, but exhale because you're prepared with the supplies you have at home.
Yeah, so let's go through it. What would an emergency kit look like? Maybe there's like kind of a basic level emergency kit, and maybe there's that like next level. I don't know, you tell me. How would you help people best kind of stock the house?
Yeah, so there are some basic things that everyone should have on hand, and then some of it will depend on the particularities of your family. There are really good guides out there through ready.gov and the EPA, as well as other resources that have lists. But some core principles are you want to make sure that you have enough non-perishable food and water to get everyone in your family through at least 3 days. And the general guideline is 1 gallon of water per person per day at least. So that's a fair amount of water. You also want to have baby formula or pet food, depending on your family. You want to have things like thinking about your family's health, at least 7 days of over-the-counter medications and prescription medications, as well as medication lists. And of course, if you have someone who is on oxygen or has advanced medical equipment, you need to prepare for that too. There's some key tools that everybody should have on hand, like flashlights with extra batteries, and then ways to charge your phone that are backup systems, like hand crank phone chargers, solar-powered chargers, or backup power banks. And then finally, everyone should have, getting away from the supplies, but just planning. Every family should have a plan for different types of emergencies. How would you get in contact? Where would you go? How would you respond as a family?
Yeah, those are certainly great things. Let's talk about, and also too, I'm thinking, should you somewhere put something to remind yourself, because I'm guessing some stuff will expire eventually. Hopefully you may never need it, but if you do and you've waited too long, so maybe put a little note somewhere in your phone or your calendar or something like that, 6 months, whatever, check.
That's a great point, because these things expire, right? Over-the-counter medications expire. Your backup food supplies will expire. So what people who do this very well do is they put it into a rotation. You buy a bunch of peanut butter, you make sure to cycle it in and out, and then you have a steady supply that you're actually using.
Okay. Let's shift just a little bit to some simple tips that we can do around the house to prevent our own self-created emergencies. Probably some simple things.
Yeah, so a lot of these accidents and emergencies that happen in the house are preventable, which is the good news. So a simple thing that families can do is make sure that you have working carbon monoxide and smoke detectors. You want to make sure that you're checking those every month or so, the batteries, and then recycling the batteries or replacing them every 6 months or so. Every family should have a small fire extinguisher in their kitchen, which I bet a lot of us don't have. Trip hazards are a big problem in the house, so making sure that your stairways and your hallways are clear, your rugs are secured, and then finally, if you have kids in the house, making sure that anything that is dangerous to them, like medications, poisons, cleaning products, paints, whatever, is up out of their reach and ideally locked away. And then finally, like we've talked about before with our older houses in the community, making sure that you're keeping an eye out for peeling, cracking, paint, and looking for signs of mold or moisture.
Yeah, quickly on that one, if you do see something like that, what should your first step be?
If you see something like lead.
Yeah.
So we stand by as a resource, the health department. You can call us if you have any concerns. Most of the homes, unfortunately, in our community do have lead paint. The big concern comes in when it is peeling, cracking, chipping, or at those friction surfaces like windows and doors where dust can be created. But if you have any concerns or questions, please just reach out to us and we can walk you through the process.
Which leads me into the next one. You guys offer some incredible programs people might not even think fall under the health department, and part of those are like like health and safety checks, which may include potentially for lead. What are those? How do you access those?
So we have a great program called the Healthy Neighborhoods Program. It's a state-run program, and it involves things like helping families access carbon monoxide and smoke detectors, fire extinguishers, cleaning supplies. We can go into the home if it's in the city of Syracuse and do a home safety inspection and just help people access and install the resources that they need to keep their families safe. I'll also mention that adult long-term care at the county also has lots of resources for older adults or vulnerable adults.
Free of charge for those checks?
Free of charge for the checks in the homes, right?
Yeah, amazing stuff. Last one for you. Probably, if you're not sure, at least contact your office, and if it's not something you can help somebody with, you'll point them in the right direction, or if you can,
absolutely.
Yeah.
So we stand by to support people with respect to any of the things we just talked about. We have other great resources like the American Red Cross and the Syracuse Fire Department who can also help with some of those in-home detectors.
Great stuff. We really appreciate you being here. You know, we'll talk again probably in a few weeks.
Look forward to it.
Katie Anderson, thanks so much.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.